Farm input subsidies have generated significant attention in Sub-Sahara, with several studies showing that these programs lead to improvement in cereal productivity amongst the beneficiary farmers. What these programs do is they provide vouchers to selected recipient households who use the vouchers to obtain inputs at a reduced market price, reduced price of the inputs. Malawi pioneered the introduction of this program, and it has registered several successes, leading to Bitcoin International Circles as the site for African Green Revolution. In this study, we particularly examine if the Malawi FISIP leads to improvement in height for age. There's literature on this topic, and it finds that the Malawi FISIP only leads to improvement in short-term child nutrition, which is weight for age and weight for height. This study tries to expound if, in combination with good healthcare quality, the farm input subsidies can lead to improvement in height for age, which is missing in the previous literature. That's the main contribution of the paper. Our method, we model height for age as a function of the subsidy program, focused antenatal care, and child nutrition participation. The focused antenatal care, this is the World Health Organization advocated minimum 4 visits for pregnant women. And the nutrition program, this is the community-based nutrition initiatives where other children participate, while others, they do not participate voluntarily. We also control for child age and gender and household characteristics, as well as district dummies. We are using 2 data sets, the Living Standards Measurement Survey and the Service Provision Assessment, both based in Malawi. We combine these 2 data sets using geographical coordinates. Our results generally show that height for age improves only when the farm input subsidy program is combined with good healthcare quality. There's a link between agriculture, nutrition, and health. Considering that the farm input subsidy is it targets cereal production, the main outcome of this program in the beneficiary households could be that there's an increased consumption of own food or reduced purchase of cereals for consumption because the productivity has increased due to the subsidies, which means there's liquidity, untying liquidity constraints within the recipient households. And this income can be used to purchase market accessed nutritious diets. If this nutrition investment from the market land on a household where its child is participating in a nutrition program and whose mother during pregnancy was exposed to the focused antenatal care, we see an improvement in child nutrition. So we need agriculture in play, nutrition and health to produce the desirable increase in height for age. The methods, we model 3 separate equations. The first equation, that's what the previous literature has done, the effects of the subsidy on height for age, and they don't find anything. Our contribution comes from equation number 2, combining the subsidy program and the focused antenatal care, and another set of the model combining the subsidy program and participation in nutrition. The second contribution, that's where we combine all the 3 programs and see how height for age changes. Our sample is of 1,688 children who are under 5. 855 of which are from the FISIP households. This is a subsidy recipient beneficiary households, and 833 from non-FISIP households, which is the control group. The household level attrition for this panel is 3.78%. Our findings show that the subsidy alone does not relate to height for age, which is the result found in the previous literature. Our contribution, subsidy combined with the focused antenatal care improves height for age by 0.98 standard deviations. The subsidy with the child participation nutrition program, while excluding mother's exposure to focused antenatal care, does not improve height for age, which means mother's exposure is also essential in improving height for age. This could be a transmission mechanism whereby birth weight would increase due to mother's exposure to the focused antenatal care, which enhances nutrition as it contains nutrition advice for the pregnant women. The subsidy, together with the focused antenatal care, is effective only for children who are below the age of 3. While we see that for the children above the age of 3, there's a need to combine the farm input subsidy, exposure to focused antenatal care for the mother, and the child participation in the nutrition enhancement programs. We did some robustness checks by using our instrumental variables approach, RELBEL, which uses internal instruments generated from heterocyticity, and the results remain qualitatively the same. Therefore, the main story we get from this is that previous literature found that farm input subsidies don't improve height for age. But we are saying farm input subsidies improve height for age, conditional on mother's exposure to focused antenatal care models and the child participation in a nutrition enhancement programs. Therefore, there's a need for interaction between the agriculture and health to provide desirable nutritional outcomes. Thank you.